Health Services is here to promote the health of MJC students through education, community referrals, and in-clinic services that support MJC's academic programs. We have 2 office locations. On East Campus, we are located in Morris Memorial Building, room 108. And on West Campus, you can find us in Yosemite Hall, room 114. Most of our services are available for currently enrolled students on a walk-in basis during our hours of operation. To verify you are a current MJC student, you need to show proof of registration in the current semester and have a zero balance. The best way to show proof of registration and a zero balance is to access your current class schedule on PiratesNet and present a screenshot or pull it up on your mobile device when you're checking in for services at the front desk. Currently enrolled students are eligible for services through our office 1 month before and after the current semester. So for example, spring students are eligible to receive services from December through May, while our fall students are eligible for services from July through January. Our regular office hours are Monday, Tuesday, Thursday, and Friday from 8 a.m. to 5 p.m. and Wednesdays from 9:30 to 5 p.m. Our last student check-in is at 4:30 p.m. and we close for lunch daily from 12 to 1 p.m. Our summer hours are Monday, Tuesday, and Thursday from 7:30 a.m. to 5:30 p.m. and Wednesdays from 8:30 a.m. to 5:30 p.m. Our last student is checked in at 5 p.m. and we also close for lunch daily from 12 to 12:30 p.m. When planning your visit to the Health Services office, keep in mind that wait times can vary from day to day and can be unpredictable, so please be sure to give yourself plenty of time for your visit. We recommend giving yourself at least 1 to 2 hours before your class starts for any office visits. Our office is able to see students for a variety of services, including minor illnesses and injuries, over-the-counter medications and feminine products, health education, immunizations, TB screenings, blood pressure screenings, hemoglobin and glucose screenings, vision and color vision screenings, referrals to our on-campus doctor clinic, mental health referrals and counseling services, sexual and reproductive health referrals, and health clearances for various academic programs. Throughout the year, we offer mental health and suicide prevention trainings through the Mental Health First Aid and QPR, or Question, Persuade, and Refer curriculums. And during the fall and spring semesters, we host the free Healthy Living presentations, which cover topics such as stress management, sexual health, suicide prevention, and many other areas. While your student health fee pays for many of the services available through the Health Services office, there are some services that do require additional fees. These services include immunizations, titers and other labs, and our physicals. Our office accepts cash, exact change is required, or most major credit cards. For our most current fee schedule, please refer to the Health Services website or call our office. All of the forms and information you need relating to your health clearance can be accessed online through the Health Services website. Simply follow this link or type the URL into your browser, and under the Health Clearances tab, select the icon of your program to access the needed documents and information. So here's an overview of your program's health clearance requirements. You need a physical, updated TB clearance, current flu and Tdap vaccinations, and titers for hepatitis B, measles, mumps, rubella, and varicella viruses. You may obtain any of the items needed for your health clearance from your primary doctor, a community clinic, or the Health Services office. However, you can only obtain the health clearance golden ticket from the Health Services office. We strongly recommend that you come to our office and have a consultation with one of our nurses, even if you wish to obtain your clearance requirements through an outside provider. This way we can help guide you through the process and minimize any chance of errors. This is your minimum submission requirements document, and it gives you details on the TB clearance, vaccines, and titers that are needed for your primary health clearance, which is called the golden ticket. It also gives you information needed for your secondary clearance date. The secondary clearance information is only needed for anyone who has in-progress items at the primary clearance date. Pay attention to the details of this document as it gives you the specific timeframes that some of these items can be obtained by, and also the specific names of the items if you obtain any of these through a provider outside of the Health Services Office. The Health History and Physical Form is a 2-page document that must be filled out as completely as possible. The first page is your self-reported health history. Be sure to complete this page before you have the medical practitioner complete your physical. Your physical must be completed within 3 months of the start of your program. The medical practitioner must review the health history, document their assessment, check one of those required boxes, sign, stamp, and date the document, and they must include their NPI number. If the practitioner does not include their NPI number, signature, or the date your physical was completed, your document will not be accepted. The physical cannot be completed by a chiropractor. It must be completed by a provider with a valid NPI number. All right, this document is called the Documentation of Two-Step TB Testing, and we use it when you obtain your TB testing outside of the Health Services Office. If you are obtaining your TB clearance through the Health Services Office, this document is not needed. Your program uses the 2-step TB screening process for your TB clearance as recommended for all healthcare personnel by the Centers for Disease Control. The 2-step TB process helps to eliminate the possibility of a false negative TB result and provides a baseline TB clearance for your program. The 2-step TB process is very specific on the timing of placement and reading of each step. TB number 1 is placed, and the results are read within 48 to 72 hours of that placement. TB number 2 cannot be placed any earlier than 7 days after TB number 1 is read. Be very specific when using an outside provider for your TB clearance that TB number 2 cannot be placed any earlier than 7 days from the reading date of TB number 1. For anyone that has a positive TB, you are required to submit a chest x-ray dated within the past 6 months that specifies what the x-ray is for and documents no evidence of active TB infection for your TB clearance. In addition to the 2-step TB clearance, you can opt to obtain TB clearance through laboratory testing. The 2 tests currently accepted for your health clearance are the QuantiFERON TB Gold or the T-Spot. The TB testing, the T-Spot, and the QuantiFERON TB Gold clearances must be documented within 3 months of the start of your program. For the 2-step TB screening, the first step may be dated within the last 12 months, but the second step must be completed within that 3-month time frame. Remember that the 2-step TB testing must be completed before obtaining any live virus vaccines. This influenza vaccination form must be completed for all flu vaccines obtained through outside providers and the Health Services Office. The influenza vaccine must be the current season's vaccine, and all of the information, such as date, site, lot, expiration, manufacturer, etc., must be documented. These immunization and titer flowcharts help guide you and your provider throughout the clearance process. For example, the Tdap vaccine flowchart shows that your Tdap must be current within the past 10 years. If it's out of date, you will need to obtain an updated Tdap vaccination. Your hepatitis B surface antibody test must show that you are presumed immune to the hepatitis B virus. If your titer shows that you are not, you may need to complete the Hep B immunization series again. Your measles, mumps, rubella, and varicella titers also need to show positive immunity. If your titers have negative or equivocal results, you may need to obtain an MMR or varicella booster vaccine. Whether or not you need a full series, a booster, or no immunizations is dependent on your titer results and documented vaccination history. While the flowcharts were created to help you assess where you are in the process, we strongly encourage you to come to the Health Services Office for any questions you might have. All right, this document is your golden ticket. This is what you will receive once you have obtained all the required health clearance items. At each of your health services office visits, our nurses will review your documentation and provide guidance on where you are in the process. Once you have met all your requirements, we will complete your golden ticket so you can get it turned into your program and start your clinicals with confidence that you and your patients are protected. On the final day of your clearance visit, you are responsible for bringing printed documentation of all health clearance requirements to the health services office. Even if you have brought these documents to the office to be reviewed by our nurses at your previous visits, if you do not have these documents printed out for your last visit, you will not be able to get your golden ticket that day. If you have any questions, please visit our office to speak with our nurses. We're happy to help you.